bipolar disorder? Well, bipolar disorder, formerly called manic depression, is a mental health condition that causes extreme mood swings that include emotional highs, mania or hypomania, and lows, that is depression. When you become depressed, you may feel sad or hopeless and lose interest or pleasure in most activities. When your mood shifts to mania or hypomania, that is less extreme than mania, you may feel euphoric, full of energy, or unusually irritable. These mood swings can affect sleep, energy, activity, judgment, behavior, and the ability to think clearly. Episodes of mood swings may occur rarely or multiple times a year. While most people will experience some emotional symptoms between episodes, some may not experience any. Although bipolar disorder is a lifelong condition, you can manage your mood swings and other symptoms by following a treatment plan. In most cases, bipolar disorder is treated with medications and psychological counseling, that is psychotherapy. Well, earlier on this channel I posted a short video about bipolar disorder. I hope you have already seen that video, and today I am going to present this illness in detail. Well, first of all, let me tell you the symptoms. Well, there are several types of bipolar and related disorder. They may include mania or hypomania and depressions. Symptoms can cause unpredictable changes in mood and behavior, resulting in significant distress and difficulty in life. Bipolar 1 disorder. You have had at least one manic episode that may be preceded or followed by hypomanic or major depressive episodes. In some cases, mania may trigger a break from reality, that is psychosis. Bipolar 2 disorder. You have had at least one major depressive episode and at least one hypomanic episode, but you have never had a manic episode. And the third type is cyclothymic disorder. In this, you have had at least 2 years or 1 year in children and teenagers of many periods of hypomania symptoms and periods of depressive symptoms, though less severe than major depression. There are other types also. These include, for example, bipolar and related disorders induced by certain drugs or alcohol or due to medical conditions such as Cushing's disease, multiple sclerosis, or stroke. Bipolar 2 disorder is not a milder form of bipolar 1 disorder but a separate diagnosis. While the manic episodes of bipolar 1 disorder can be severe and dangerous, individuals with bipolar 2 disorders can be depressed for longer periods, which can cause significant impairment. Although bipolar disorder can occur at any age, typically it is diagnosed in the teenage years or early 20s. Symptoms can vary from person to person and symptoms may vary over time. Now, let me tell you something about mania and hypomania. Well, mania and hypomania are two distinct types of episodes, but they have the same symptoms. Mania is more severe than hypomania and causes more noticeable problems at work, school, and social activities, as well as relationship difficulties. Mania may also trigger a break from reality, that is psychosis, and it may require hospitalization. Both a manic and a hypomanic episode include 3 or more of the symptoms which I am going to tell you. Abnormally upbeat, jumpy, or wired, increased activity, energy, or agitation, exaggerated sense of well-being and self-confidence, that is euphoria, decreased need for sleep, unusual talkativeness, racing thoughts, distractibility, poor decision making, for example, going on buying sprees, taking sexual risks, or making foolish investments. Now I'll tell you something about major depressive episode. A major depressive episode includes symptoms that are severe enough to cause noticeable difficulty in day-to-day activities such as work, school, social activities, or relationships. An episode includes 5 or more of the symptoms which I am going to tell you now. Depressed moods such as feeling sad, empty, hopelessness, or tearful in children and teens. Depressed mood can appear as irritability, marked loss of interest, or feeling no pleasure in all or almost all activities. Significant weight loss when not dieting, weight gain or decrease or increase in appetite, In children, failure to gain weight as expected can be a sign of depression. Either insomnia or sleeping too much, either restlessness or slowed behavior, fatigue or loss of energy, feelings of worthlessness or excessive or inappropriate guilt, decreased ability to think or concentrate, or indecisiveness, thinking about planning or attempting suicide. Well, as I told you, and out of these symptoms, at least five should be present to label it as a major depressive episode. Okay. And now I'll tell you some other features of bipolar disorder. Signs and symptoms of bipolar 1 and bipolar 2 disorders may include other features such as anxious distress, melancholy, psychosis, or others. The timing of symptoms may include diagnostic labels such as mixed or rapid cycling. In addition, bipolar symptoms may occur during pregnancy or change with the seasons. Now I'll tell you some symptoms in children and teenagers. Symptoms of bipolar disorder can be difficult to identify in children and teens. It is often hard to tell whether these are normal ups and downs, the result of stress or trauma, or signs of mental health problem other than bipolar disorder. Children and teens may have distinct major depressive or manic or hypomanic episodes, but the pattern can vary from that of adults with bipolar disorder. And moods can rapidly shift during episodes. Some children may have periods without mood symptoms between episodes. The most prominent signs of bipolar disorder in children and teenagers may include severe mood swings that are different from their usual mood swings. And now I should tell you should when to see a doctor. Despite the mood extreme, people with bipolar disorder often do not recognize how much their emotional instability disrupts their lives and the lives of their loved ones, and do not get the treatment they need. And if you are like some people with bipolar disorder, you may enjoy the feelings of euphoria and cycles of being more productive. However, this euphoria is always followed by an emotional crash that can leave you depressed, worn out, and perhaps in financial, legal, or relationship troubles. If you have any signs of depression or mania, you should see your doctor or mental health professional. Bipolar disorder does not get better on its own. Getting treatment from a mental health professional with experience in bipolar disorder can help you get your symptoms under control. I'll tell you some emergency situations. Well, suicidal thoughts and behavior are common among people with bipolar disorder. If you have thoughts of hurting yourself, you should call your local emergency number as soon as possible, or go to an emergency room, or confide in a trusted relative or friend. Okay, or you can call suicide hotline number. If you have a loved one who is in danger of suicide or has made a suicide attempt, make sure someone stays with that person, and you can call your local emergency number immediately. Or if you think you can do so safely, take the person to the nearest hospital emergency room. Okay, now I'll tell you about the causes of bipolar disorder. Well, the exact cause of bipolar disorder is unknown, but several factors may be involved, such as biological differences. People with bipolar disorder appear to have physical changes in their brains. The significance of these changes is still uncertain, but may eventually help pinpoint causes. Genetics. Bipolar disorder is more common in people who have a first-degree relatives, such as a sibling or parent with the condition. Researchers are trying to find genes that may be involved in causing bipolar disorder. Now, there are some risk factors that may increase the risk of developing bipolar disorder or act as a trigger for the first episode include having a first-degree relative, such as parent or sibling, with bipolar disorder, periods of high stress, such as the death of a loved one or other traumatic event, drug or alcohol abuse. Okay. Now I'll tell you some complications of bipolar disorder. Well, if left untreated, bipolar disorder can result in serious problems that affect every area of your life, such as problems related to drug and alcohol use, suicide or suicide attempts, legal or financial problems, damaged relationships, poor work or school performance. There are some co-occurring conditions with bipolar disorder. Well, if you have bipolar disorder, you may also have another health condition that needs to be treated along with bipolar disorder. Some conditions can worsen bipolar disorder symptoms or make treatment less successful. Examples include anxiety disorders. Also, eating disorder may be co-occurring condition. Attention deficit hyperactivity disorder (ADHD) can also be co-occurring, and there may be alcohol or drug problems, physical health problems such as heart disease, thyroid problems, headaches, or obesity. Okay. Now I'll tell you some preventive measures. Well, there is no sure way to prevent bipolar disorder. However, getting treatment at the earliest sign of a mental health disorder can help prevent bipolar disorder or other mental health conditions from worsening. If you have been diagnosed with bipolar disorder, some strategies can help prevent minor symptoms from becoming full-blown episodes of mania or depression. You should pay attention to warning signs. While addressing symptoms early on can prevent episodes from getting worse. You may have identified a pattern to your bipolar episode and what triggers them. Call your doctor if you feel you are falling into an episode of depression or mania. Involve family members or friends in watching for warning signs. You should avoid drugs and alcohol. Using alcohol or recreational drugs can worsen your symptoms and make them more likely to come back. You should take your medication exactly as directed. Well, you may be tempted to stop treatment, but do not. Stopping your medication or reducing your dose on your own may cause withdrawal effects, or your symptoms may worsen or return. Now I'll tell you about the diagnosis. Okay. Well, to determine if you have bipolar disorder, your evaluation may include physical exam. Your doctor may do a physical exam and lab test to identify any medical problems that could be causing your symptoms. Psychiatric assessment. When patients come to us, we may refer you to a psychiatrist who will talk to you about your thoughts, feelings, and behavior patterns. You may also fill out a psychological self-assessment or questionnaire. With your permission, family members or close friends may be asked to provide information about your symptom. Well, when I was working in Australia, my first job was in psychiatric department, and I used to talk to so many family members of the patients who were suffering from different psychiatric illnesses. Okay. Also, in your diagnosis, we can also ask for mood charting. You may be asked to keep a daily record of your moods, sleep pattern, or other factors that could help with diagnosis and finding the right treatment. Criteria for bipolar disorder. Well, your mental health professional or psychiatrist may compare your symptom with the criteria for bipolar and related disorder in the Diagnostic and Statistical Manual of Mental Disorder, that is DSM-5, published by American Psychiatric Associations. Okay. Now let me tell you something about diagnosis in children. Well, although diagnosis of children and teenagers with bipolar disorder includes the same criteria that are used for adults, symptoms in children and teens often have different patterns and may not fit neatly into the diagnostic categories. Also, children who have bipolar disorder are frequently also diagnosed with other mental health conditions such as attention deficit hyperactivity disorder, ADHD, or behavioral problems, which can make diagnosis more complicated. Referral to a child psychiatrist with experience in bipolar disorder is recommended. Now let me tell you the treatment. Well, treatment is best guided by a medical doctor who specializes in diagnosing and treating mental health conditions. Psychiatrist who is skilled in treating bipolar and related disorders. You may have a treatment team that also includes a psychologist, social worker, and psychiatric nurse. Bipolar disorder is a lifelong condition. Treatment is directed at managing symptoms. Depending on your needs, treatment may include medications. Often you will need to start taking medications to balance your moods right away. Continued treatment. Bipolar disorder requires lifelong treatment with medications even during periods when you feel better. People who skip maintenance treatment are at high risk of a relapse of symptoms or having minor mood changes turn into full-blown mania or depression. Day treatment programs. Your doctor may recommend a day treatment program. These programs provide the support and counseling you need while you get symptoms under control. Substance abuse treatment. If you have problems with alcohol or drugs, you will also need substance abuse treatment. Otherwise, it can be very difficult to manage bipolar disorder. Hospitalization. Your doctor may recommend hospitalization if you are behaving dangerously, you feel suicidal, or you become detached from reality. That is psychosis. Okay. Getting psychiatric treatment at a hospital can help keep you calm and safe and stabilize your mood, whether you are having a manic or major depressive episode. The primary treatment for bipolar disorder includes medication and psychological counseling, that is psychotherapy, to control symptoms, and also may include education and support groups. Now I'll tell you about some medications. Well, a number of medications are used to treat bipolar disorder. The types and doses of medications prescribed are based on your particular symptoms. Medications may include mood stabilizer. Well, you will typically need mood stabilizing medication to control manic or hypomanic episodes. Examples of mood stabilizer include lithium, that comes with the name of lithobid, valproic acid, that comes with the name of dipaquine, divalproic sodium, that is dipacort, carbamazepine, that comes with the name of tegretol, and lamotrigine, that comes with the name of lamictal. Antipsychotics. If symptoms of depression or mania persist in spite of treatment with other medications, adding an antipsychotic drug such as olanzapine, that comes with the name of Zyprexa, risperidone, that comes with the name of risperidol, or quetiapine, that comes with the name of Seroquel, or some other medicine may help. Your doctor may prescribe some of these medications alone or along with a mood stabilizer. Antidepressants. Your doctor may add an antidepressant to help manage depression. Because an antidepressant can sometimes trigger a manic episode, it is usually prescribed along with a mood stabilizer or antipsychotic. There are some combination medicine, that is antidepressant and antipsychotic combination. The medication Symbiex combines the antidepressant fluoxetine and the antipsychotic olanzapine. It works as a depression treatment and a mood stabilizer. Also, we may prescribe anti-anxiety medications for shorter duration, while benzodiazepines may help with anxiety and improve sleep, but are usually used on short-term basis because of their side effects. Now, let me tell you about the finding the right medications. Well, finding the right medication or medications for you will likely take some trial and error. If one medicine does not work well for you, there are several others to try. This process requires patience, as some medications need weeks to months to take full effect. Generally, only one medication is changed at a time so that your doctor can identify which medications work to relieve your symptoms with the least bothersome side effects. Medications also may need to be adjusted as your symptoms change. Side effects. Mild side effects can often improve as you find the right medication and doses that work for you, and your body adjusts to the medications. You should talk to your doctor or mental health professional if you have bothersome side effects. Do not make changes or stop taking your medications. If you stop your medication, you may experience withdrawal effects, or your symptoms may worsen or return. You may become very depressed, feel suicidal, or go into a manic or hypomanic episode. If you think you need to make a change, you should call your doctor. Now I'll tell you about some other special situations such as pregnancy. A number of medications for bipolar disorder can be associated with birth defects and can pass through breast milk to your baby. Certain medications such as valproic acid and divalproic sodium, which should not be used during pregnancy. Also, birth control medications may lose effectiveness when taken along with certain bipolar disorder medications. Discuss treatment options with your doctor before you become pregnant. If possible, if you are taking medication to treat your bipolar disorder and think you may be pregnant, talk to your doctor right away. Now I'll tell you something about psychotherapy. Well, psychotherapy is a vital part of bipolar disorder treatment and can be provided in individual, family, or group settings. Several types of therapy may be helpful. These include interpersonal and social rhythm therapy, This focuses on stabilization of daily rhythms such as sleeping, waking, and meal times. A consistent routine allows for better mood management. People with bipolar disorder may benefit from establishing a daily routine for sleep, diet, and exercise. Cognitive behavioral therapy (CBT). The focus is identifying unhealthy negative beliefs and behavior and replacing them with healthy positive ones. Well, regarding CBT, I have talked about CBT in so many of my previous videos related to psychiatric disorders. Okay, CBT can help identify what triggers your bipolar episodes. You also learn effective strategies to manage stress and to cope with upsetting situations. Psychoeducation. Learning about bipolar disorder, that is psychoeducation, can help you and your loved ones understand the condition. Knowing what's going on can help you get the best support, identify issues, make a plan to prevent relapse, and stick with treatment. And this channel is basically a medical education channel, and you can watch so many medical related videos because this channel is created especially to help humanity across the world. Okay, because if you know your illness, and if you have a strong knowledge of your illness, you can prevent so many dangerous complications. Okay. Also, we can ask for family focused therapy. Family support and communication can help you stick with your treatment plan and help you and your loved ones recognize and manage warning signs of mood swings. There are some other treatment options. Well, depending on your need, other treatments may be added to your depression therapy. For example, during electroconvulsive therapy, that is ECT, electrical currents are passed through the brain that intentionally trigger a brief seizure. ECT seems to cause changes in brain chemistry that can reverse symptoms of certain mental illnesses. And ECT may be an option for bipolar treatment if you do not get better with medications, or if you cannot take antidepressant for health reasons such as pregnancy or at high risk of suicide. Transcranial magnetic stimulation, that is TMS, is being investigated as an option for those who have not responded to antidepressants. Now I'll tell you something about treatment in children and teenagers. Well, treatment for children and teenagers are generally decided on a case-by-case basis depending on symptoms, medication side effects, and other factors. Okay. Now I'll tell you some about lifestyle and home remedies. Well, you will probably need to make lifestyle changes to stop cycles of behavior that worsen your bipolar disorder. Here are some simple steps which I can tell you. While quit drinking or using recreational drugs. One of the biggest concerns with bipolar disorder is the negative consequences of risk-taking behavior and drug or alcohol abuse. You should get help if you have trouble quitting on your own. Form healthy relationships. Surround yourself with people who are positive influencers. Friends and family members can provide support and help you watch for warning signs of mood shifts. Create a healthy routine. Having a regular routine for sleeping, eating, and physical activity can help balance your mood. Check with your doctor before starting any exercise program. Eat a healthy diet. If you take lithium, you should talk with your doctor about appropriate fluid and salt intake. If you have trouble sleeping, you should talk to your doctor and mental health professional about what you can do. You should check first before taking other medication. You should call the doctor who is treating you for bipolar disorder before you take medication prescribed by another doctor or any over-the-counter supplements or medications. Sometimes other medication trigger episodes of depression or mania or may interfere with medication you are taking for bipolar disorder. Consider keeping a mood chart. Keeping a record of your daily moods, treatment, sleep, activities, and feelings may help identify triggers, effective treatment options, and when treatment needs to be adjusted. Regarding alternative medicine, there is not much research on alternative or complete medicine, sometimes called integrative medicine, and bipolar disorder. Most of the studies are on major depression, so it is not clear how these non-traditional approaches work for bipolar disorder. Well, personally, I do not recommend any alternative medicine for bipolar disorder, and the medication which I told you just now, you can take according to your doctor's advice. Okay. Well, this was my video about bipolar disorder. I hope you like this video. And if you have any questions about bipolar disorder, or if you want me to upload another video about any mental illness or any other physical illness, for that video is not already there, you can post in the comment section. Thanks for watching this video. See you in next video. Bye for now.